Hello, my name is Chelsea Cooley and I am an NMSU grad student earning an MPH degree. This presentation will cover CAM and its applications in public health. I will outline a few ideas to improve access to CAM therapies for a wider range of individuals. So what is CAM? CAM refers to complementary and alternative medicine. Complementary medicine is used in addition to allopathic medicine, also called conventional or Western medicine. Alternative medicine is used in place of allopathic medicine. I will give you a couple of examples. For example, a man with lower back pain consults with his physician who refers him to a physical therapist. The physical therapist teaches the patient exercises to reduce the tension in his back, but also suggests the man attends yoga classes. Yoga is complementary that he uses in addition to PT prescribed by his doctor. Another patient with gout meets with several specialists. After expensive tests and prescription medications, he still feels a lot of pain in his joints. He decides to meet with a naturopathic doctor who gives him nutritional advice and a supplement to decrease uric acid buildup. After feeling some relief, the man decides to stop seeing his MD entirely. This is alternative medicine. Some people use alternative therapies instead of meeting with a doctor and have serious health consequences, and sometimes pseudoscience enters mainstream media. Therefore, CAM has a very bad reputation in some healthcare circles, but peer-reviewed research supports the use of CAM. Here are some quotes about yoga and meditation. When you think CAM, think also prevention. This figure shows yoga, meditation, and nutrition counseling, and the benefits each might have for overall health. Yoga alleviates depression and anxiety, meditation, stress and lower blood pressure, and proper nutrition prevents diabetes and obesity. Many other treatments fall under the CAM umbrella. These include acupuncture, massage, herbal medicine, and psychotherapy. Many types of therapists practice CAM. Some are highly qualified and experienced, and some are hoping to make a profit from people's eagerness for wellness, having little experience or few credentials. There are different types of licenses for CAM. For example, registered yoga teachers, registered dietitian nutritionists, licensed massage therapists, naturopathic doctors, and doctors of acupuncture and oriental medicine. For mental health, each state certifies master's level marriage and family therapists, licensed professional counselors, licensed clinical social workers, and licensed clinical psychologists at the doctoral level. Certifications matter because they verify that someone has gone through training and practicum with experts in their field, including training in legal issues. For several reasons, CAM utilization is a cultural affair. For one thing, CAM therapies are usually only available to those who can afford to pay for them out of pocket. In addition, the likelihood that a person will use CAM also depends on his or her age, race, ethnicity, nationality, SE status, and education. The most common demographic to utilize CAM, at least in the US, is wealthy white women. It's fine if you fall into this category, but how can we improve access for more people? Income is the largest social determinant of health, allowing one not only to directly purchase preventive care, but also provide for many other health-preserving lifestyles. Our textbook defines access as the ability to obtain needed, affordable, convenient, acceptable, and effective personal health services in a timely manner. The U.S. healthcare system is largely inequitable. Those with higher incomes are more likely to use CAM. There are 5 components to access. The first is availability, or how well a treatment meets the client's needs. For example, are yoga classes offered in Spanish? Second is accessibility, or the client's ability to reach treatment. Is there a bus stop next to the studio? The third is affordability. Is the service covered by insurance? Fourth is accommodation. Is the studio open at times when the client is not working? Last is acceptability, which can be a patient's attitude towards a treatment or a practitioner's attitude towards a patient. For example, is a massage therapist willing to lay hands on a homeless person? So what prevents access to CAM? Cost is the biggest hindrance. Even the middle class hesitates to pay for CAM, which is often considered a luxury. Location is another drawback. A meditation center in the forest off a dirt road where there is no bus route is inaccessible to anyone without a car. Cultural acceptability is another factor. For example, if both my parents are registered nurses and they tell me that naturopathic medicine is ridiculous, then I'm likely to believe them. Belongingness is also an issue. Few people enjoy feeling like the odd one out in a room full of people who don't share their appearance or cultural experience. Why should we improve access to CAM? Well, the first answer is prevention. Things like yoga, meditation, massage, and nutrition help prevent disease. The second reason is community building. CAM classes and workshops take place in a community setting. CAM is also a growing industry. Americans spend approximately $16 billion on yoga alone. Public schools are great places to introduce CAM therapies. They offer access to children across cultures and SE status, and school bus transportation is already in place. For adults, free clinics give access to CAM for low-income people. Also, community centers have facilities for group classes or workshops and are located by buses. For-profit private insurers are not lining up to add new services, but what if preventive services under the CAM umbrella were cost-saving measures? Disease prevention saves money. The federal government can lead the way by adding CAM to services covered by Medicare and Medicaid. In some counties in California, services like acupuncture are already covered by public health insurance. Yoga and meditation have entered a variety of schools, prisons, and community centers thanks to help from the nonprofit sector. And these methods have been incorporated into free substance abuse programs like AA and refuge recovery.